is Hannah Watkey. I'm the physician assistant student. I'm going to be doing a general examination of you today. If you don't mind, please remove your shirt, socks, and shoes, and I just washed my hands. I'm noting the presenting appearance and general health status. I am assessing if stated age corresponds with apparent age. I am assessing personal hygiene and grooming, noting any body or breath odors. I am inspecting body habitus and any obvious physical deformities. I am inspecting posture and motor activity. I am inspecting facial expressions, looking for signs of pain or discomfort. I would perform a mental status exam at this time. I will check the patient's height and weight. I will assess the patient's oral temperature by placing the thermometer under the tongue and checking in 1 minute or after beeps. Please hold on to it. I will assess the rate, rhythm, and amplitude of the pulse using the pads of my middle and index fingers. I will count the pulse for 15 seconds and multiply by 4. I will count the rhythm and depth of respirations for 15 seconds and multiply by 4. Okay, thank you. I will ensure that the width of the bladder is approximately 40% of the arm circumference and that the length is approximately 80%. Both. Okay, I will properly place the cup 1 inch above the antecubital fossa, or 2.5 centimeters. I will measure the palpable systolic blood pressure. Okay, thank you. I will reinflate the cup to 30 millimeters of mercury above palpable systolic pressure. I will listen for the onset of quarter-cough sounds, noting the systolic blood pressure. I will slowly deflate the cup 2 to 3 millimeters per second. I will listen for the cessation of quarter-cough sounds, noting the diastolic blood pressure. I will repeat the procedure on the opposite arm while the patient is seated, and I will repeat the procedure if necessary in the standing and supine position. Okay. Okay. Thank you so much. And if I could please have you stand. I am inspecting skin pigmentation, noting any discoloration. I am inspecting for masses, rashes, or lesions. Okay. I am palpating the skin, temperature, moisture, and texture. I am palpating, noting mobility and turgor. Okay, please have a seat. I am inspecting the fingernails and toenails for signs of cyanosis, brittleness, lesions, lines, and clubbing. Okay. I am inspecting the head and skull for position, shape, size, symmetry, contour, and deformities. I am inspecting scalp for hair growth pattern, hair texture, lesions, lice, nits, and dandruff. I am inspecting face for symmetry, hair growth, masses, and edema. I am palpating skull for tenderness, contour, deformities, and masses. I am palpating scalp for mobility and tenderness. I am palpating temporal arteries for pulsations and tenderness. I am palpating the temporomandibular joint for crepitus, deformities, and tenderness. So please open it up. Very good. I am palpating the parotid glands for edema and tenderness. Okay. I am palpating the forehead, the supraorbital ridge, the zygoma, and the mandible for tenderness. How is that? Great. Okay. I am inspecting the eyebrows, eyelids, and eyelashes, noting asymmetry, erythema, or lesions. I am inspecting the eyelids, noting position and closure. I am inspecting the area over the lacrimal apparatus for edema or lesions. I am palpating the area over the lacrimal apparatus for tenderness. I am attempting to express discharge from the nasal lacrimal duct. Okay. I am inspecting the bulbar and palpebral conjunctivi, looking at injections or lesions. I am inspecting color and noting the presence of a junction or blood. So please look up, please look down. Very good. Okay, I will now test near visual acuity. I will test with and without corrective lenses. Please cover your left eye and read the lowest line that you can.
3748.
Please cover your right eye
3748.
and use both eyes, please.
3748.
Very good. Look at me, please. Thank you. Very good. Okay. I will now test your visual fields by gross confrontation. So please hold your hands like this and point when you see my fingers come into your line of vision. Okay. Very good. Okay, last one. Very good. Okay, please follow the tip of my pen light and try not to turn your head, just use your eyes. Very good. Okay, I will now test for accommodation, convergence, and laid lag. So please look at the tip of my pen light when it comes into your vision.
Okay.
Very good. Keep looking at the tip of my pen light, please. Very good. And then again, please keep looking at the tip of my pen light. Very good. I will use tangential lighting to inspect the cornea and assess the depth of the anterior chamber, looking for any crescent-shaped shadows on the medial aspect. Look straight forward, please. Very good. Continue to look forward. Very good. I will now test the pupillary light reflex with direct and consensual test. Continue to look forward, please. Very good. Continue to look forward. Very good. I will dim the lights for the next part of the exam. Okay. I am assessing corneal reflex for symmetry. I will assess red reflex, inspect the optic disc, margins, cup to disc ratio, the retinal arteries, veins, and the condition of the retina. I will have the patient look into the light to assess the fovea and macula. Now look into the light. Okay, look straight ahead. And now look into the light. Very good. Okay. Okay. I am inspecting the auricle for discharge, deformities, and lesions. I am palpating the auricle, the tragus, and the mastoid for tenderness and masses. Very good. I will perform the whisper test. So please let me know what word I am whispering.
Football.
Very good.
Baseball.
Very good. Okay. Okay, next I will use my pinky as a fulcrum and pull the ear upwards and outwards. I am noting the condition of the external canal, noting the amount of cerumen, looking for any signs of inflammation, foreign bodies, or edema. The tympanic membrane is pearly gray. Okay, I visualized the landmarks of the tympanic membrane, the malleus, umbo, and cone of light. Okay, next I will perform the nasal patency exam. So please cover up one nostril and then inhale, and you can exhale, okay? Then the other nostril, inhale, exhale. Okay, how was that?
Just fine.
Okay. I'm palpating for tenderness. You feel any tenderness?
No.
Okay. So next I will inspect the nasal mucosa, the turbinates for polyps, and the nasal septum for perforation or deviation. Okay. Okay. Very good. I'm going to palpate the frontal sinuses and maxillary sinuses for tenderness. Do you feel any tenderness?
No, ma'am.
Okay, very good. Okay. I will now inspect the nasolabial folds, lips, buccal mucosa, gingiva, floor of mouth, and teeth. So please open up. Okay. I am inspecting for inflammation, lesions, and the condition of the dentition. Okay, very good. I am inspecting the posterior pharynx, noting the appearance of the tonsils. Please say ah.
Ah.
Okay, I'm inspecting phonation and symmetrical rise. Say ah again, sorry.
Ah.
Of the palate and uvula. Very good. Please take out your tongue. I am assessing, noting, and open your mouth, please, that the tongue is midline, the color, and its texture. I will now palpate the tongue for induration and masses. Very good. Okay. I am assessing, noting for asymmetry, thyromegaly, masses, or jugular vein distension. I am inspecting the thyroid and isthmus for edema or masses. Okay, please swallow. Okay. I will laterally deplace the trachea and have the patient swallow, please. Very good. And I will palpate the isthmus. Very good. Okay. Now I will palpate the lymph nodes. Preauricle, postauricle, occipital, tonsillar, submandibular, submental, superficial cervical chain, posterior cervical chain, please turn your head,
Mm-hmm.
deep cervical chain, turn your head the other way, and supraclavicular, please take a deep breath, Thank you very much.